you. That was the first time that I've ever only had to say that once. All right, well, good morning and thank you all for being here. I am Shaquanda Gordon and I will be your moderator for today. So excited and we want to jump right in. Welcome to Stay Woke, a town hall and resource fair on Black wealth and health inequities. Huge thank you to the women of Alpha Kappa Alpha Sorority Incorporated, Beta Chi Omega chapter, and 1,000 families of color for their foresight to convene here today. Their commitment to helping our community and decision makers anticipate, prepare for, and shape the future rather than simply reacting to it is commendable. Can we get a round of applause for our convening partners? We also want to give a special thank you to all the partner organizations and businesses that helped make this event possible today. Again, 1,000 families of color, Alpha Kappa Alpha Sorority Incorporated, Beta Chi Omega chapter, Black Impact Collaborative, Exploratory Committee of Exemplary Women, Grand Rapids African American Health Institute, Grand Rapids Area Black Businesses, Grand Rapids Black Nurses Association, GRAAHI, Lake Michigan Credit Union, Link Up, Michigan Minority Supplier Development Council, NAACP, NARAB, National Association of Real Estate Brokers, Realtors of West Michigan Association, Sisters in Development, Project Greene, Urban League of West Michigan, and Your Pretty Pennies. Thank you to all of our participating partners. So today we come together to explore this critical intersection where wealth, housing, and health converge to shape the lives and futures of our communities. These are not separate issues. They are deeply connected threads in a larger story. One of resilience in the face of systemic barriers, and one that demands our urgent attention and collective action. We know the facts. Black families continue to face a staggering racial wealth gap. Home ownership, the cornerstone of generational wealth, is still out of reach for too many. And health disparities persist, not because of biology, but because of the inequity in access, treatment, and opportunity. But this town hall is not just about challenges, it's about the solutions. The policies, partnerships, the people who are working every day to break these cycles and build something better. We are here to listen, to learn, and to lead. And because when we invest in Black health, we protect Black wealth. When we ensure fair housing, we create stable, thriving communities. And when we address all three of these, we don't just repair the past, but we reimagine the future. So let's begin that work right here and right now. I want to welcome to the stage our keynote, my new friend, Ms. Syreeta Washington.
Good morning.
Good morning.
All right. Okay, let me put my glasses on, because when you get a little older, you find out that you can't see too well. All right, so good morning. Again, my name is Syreeta Washington. And first, I just want to say, give yourself a round of applause for coming out this early Saturday. So I do want to say something. I'm a professor, and so I know one part of when you're listening to someone is staying engaged. So turn to your neighbor and say your neighbor. Say neighbor.
Neighbor.
Stay woke.
Stay woke.
Okay, I don't think they heard you. Neighbor.
Neighbor.
Stay woke.
Stay woke.
Okay, neighbor.
Neighbor.
I'm telling you. Stay woke. Because that's why we're here, right? To stay woke. So I am elated that you have joined us for a much needed conversation about health and wealth inequities. My task today, or this morning, is to provide a brief overview of this justice term or concept that we call woke, which has now been co-opted by mainstream America. So let me first explain why history is important. History informs, history contextualizes, history follows change and continuity. History also offers complexity to questions, themes, and issues. For Black people in this country, let's admit, our history has been complex. For people of color, let's admit, in this country, our history, your history has been complex. So we have faced and experienced many injustices, from chattel slavery, lynchings, low-wage earnings, unemployment, education inequities, the school to prison pipeline, the 21st century slavery, known as incarceration, and healthcare inequities, including high rates of infant and maternal mortality. Regarding healthcare, Black people and people of color have experienced significant disparities compared to their white counterparts, leading to the worst health outcomes and shorter lifespans. More injustices plague the Black community, but I am limited on time. However, the underlying cause of these injustices are structural and systemic racism. The historical concept of woke is pertained to consciousness and consciousness of injustice. Historically, woke was a call for Black people not to be silent and to be aware of the systems of oppression, discrimination, and racism that harm us, harm our families, and plague our communities. And they also otherwise put us at a disadvantage within a white supremacist society. But this idea of woke is documented as far back as 1920s. One of my heroes, the Jamaican philosopher Marcus Garvey, who was the founder of the Universal Negro Improvement Association and the Negro World Weekly publication, exhorted members of the Black diaspora in America, Jamaica, and elsewhere to join the cause of Pan-Africanism. And he was calling them to wake up. Garvey's call to wake up was to open their eyes to systemic racism and to get involved in politics. Garvey also wanted Black Americans to wake up and embrace their heritage and to be proud of how they look and to maintain a sense of identity. Garvey proclaimed that Black is beautiful. And that was before it was popularized in the 1960s. Garvey's philosophies also connect to our panel discussion on wealth. He wanted Black people to be economically strong. Now, another historical fact. By 1938, the iconic American blues musician Lead Belly recorded the song Scottsboro Boys. Anybody heard it? I would sing it, but I'm short on time, but and then also say I can't sing it. But his ballad tells the true story of 9 Black youth from the ages of 13 to 19 who were falsely accused of raping 2 white women in Scottsboro, Alabama, and subsequently convicted by an all-white jury and sentenced to death. Though they were thankfully freed after several appeals and trials. But in a song that he wrote regarding Alabama, he said this: "I'm going to tell you of colored people You better watch out. In an interview, Lead Belly said the song Scottsboro was a message to stay woke and to keep your eyes open. So you see, the concept of woke or stay woke is a call to action. We are called, each and every last one of us, especially Black Americans, to be on guard, to be vigilant, and to be attentive. We are called to use our voice. So when you see something, say something. We are called to fight for justice, especially when injustice reveals its ugly head. So here's the thing. We do not have to tolerate racist acts, discrimination, or micro-assaults. Some people call them microaggressions. But I like Kennedy's word when he says these aggressions are more than just aggression. It's an assault. So unfortunately, we must realize this fact as well. That when we, especially Black Americans, take pride in our Black identity, remember, Black is beautiful. It is weaponized in this country and used against us. So woke is now a political weapon. Now, I don't know how many faith people was in the house, but here's just a little message for the faith folks. The Bible, though it doesn't use the word woke or say woke, the Bible also emphasizes the concept of being woke. We are told in the Old Testament and the New to stand against and fight against injustice and oppression, to care for others, especially widows, orphans, and those who are marginalized. We're also told to be aware of the evil sway of the enemy. Now, Jesus and the Apostle Paul admonish their followers to do a couple of things. Stay diligent and stay alert. That sounds like stay woke to me. So, as I close, this is why history is important. Our ancestors are admonishing us to remain engaged. I heard someone earlier this year when Donald Trump got elected, and they said, we're sitting down, our fight is over. And I wrote back and said, our fight is never over. And we cannot afford to sit down. So, we must remain engaged. We can never give up. And we can never be silent regarding social injustices. Amen? Oh, I forgot, we're not at church. Okay. All right. So, as I get ready to close, look in your bags, your welcome bags. Did y'all get a welcome bag? We didn't. Oh, okay. That's okay. Y'all can get a welcome bag. When you get the welcome bag, you're going to see a bookmark. Okay? And in the bookmark, I want you to say this pledge. Well, one, we're going to say this together because I am a professor. Y'all got to wake up because it's still early. So we're going to say this pledge. You're just going to repeat after me. I'll say it first, and then you get it in your heart. And remember, you made this pledge. Okay? All right. So here's the pledge. I pledge to stay woke. Oh, wait. I'm going to say it first. You got to think about it to make sure you're going to make this pledge. Because remember, once you say it, God is watching. Oh, we got a church. Somebody is watching. All right. So I'm going to say it first. I pledge to stay woke, awake to injustice, alert to opportunities to listen deeply, speak truthfully, and be committed to dismantling systems that uphold oppression, discrimination, and racism. Okay? Now, how many of you can say this pledge? I can. All right, we're going to stand up. All right, so I'm a professor and a minister, so that's one thing, you don't give me a mic. All right. I pledge to stay woke, awake to injustice, alert to opportunities, to listen deeply, speak truthfully, and be committed to dismantling systems that uphold oppression, discrimination, and racism. Now fight the power! All right, thank you all.
All right, good morning again. So I am Kenisha Dorsey, and I'm the president of Alpha Kappa Sorority Incorporated, Beta Chi Omega. And I just want to take the opportunity to thank our sisters for showing up today. As you know, it's early, but they were here even earlier. So if you are a member of Alpha Kappa Sorority Incorporated, just stand up, wave your hand, let us know where you're at. Familiar with Alpha Kappa sorority. You hear sorority, you may think some other things, but we are college-educated women who are making a difference in our community, right? So nationally, we have existed for over 117 years. Locally, in this community, over 56 years. Our chapter locally comprised of over 130 women who are making a difference right here in our community. I see some of my other Greek sisters in the room, so I want to recognize them because they are also doing the work that we are charged with. I see members of Delta Sigma Theta, Sigma Gamma Rho. Oh, right here. That's okay because you may hear our names, but we're all charged with the same mission. We are doing work. And today we are just so excited about all the information that we will hear. We have some experts in the room. But what I want to charge you with today is, you're going to hear the information, but I need each of us to take on a charge. We need to be about action. We're constantly partnering with others. We have 15 Pearls and a Promise in the room. Tasha, where are you? 15 Pearls and a Promise is our foundation. We do a lot of work with our foundation. And then we're looking to continue the partnership with all of you in this room today. So thank you. And with that, I am going to bring up Tanya Howell-May.
Wonderful. Good morning. And welcome. I am here to represent 1,000 Families of Color. I serve as their executive director and also a life member. Is that right? Alpha Kappa Alpha sorority. I need to just welcome you and just thank you again, everyone who showed up early this morning to make sure that this place was done in excellence and ready for all of the almost 100 people that registered for this event today. I have to thank the almost 20 vendor partners who decided to come to share information with the community because it's that important. I want to find my notes. So we don't move it. I want to give a special thanks to Lake Michigan Credit Union, Huntington Bank, and the Exploratory Committee of Exemplary Women who all sponsored this event today. 1,000 families, give them every family, especially families of color, deserve the opportunity to build wealth, to own property, to leave a legacy, and live in health, both physically and financially. Our mission is to help families to increase their net worth through homeownership, entrepreneurship, financial literacy, and wealth building. We understand the challenges our community faces, and that's why we're here today. Systematic barriers, lack of access, disparities in health and wealth, but we also know the strength of our ancestors, the brilliance of our youth, right? The power of coming together with intention like we're doing here today. So Stay Woke is not just an event. I've said it a few times, it's a movement. It's a gathering of creatives, change makers, people like you who make a difference every day by serving this community. So today, as we listen to the panelists on business, housing, and health, we encourage you to take notes, build connections in this room. There's a lot of people you need to get to know. And leave here with a renewed sense of purpose. Let today plant seeds that grow into wealth and wellness and wisdom for generations to come. We're honored that you're here. And again, I thank my sisters from Alpha Kappa Alpha. You just outdid yourself. But we're going to have a great time today, and I hope you all enjoy it. Okay? Our next presenter is our health committee. I'm going to bring up none other than the Laura Moody, who will be the secretary of our health panel. And the panelists on the health panel, you can come on up, and then we'll have you introduce yourselves, and we'll get started with that panel. And we're right on time, so I love it. Yep. Oh, one more thing, I'm sorry, before you move that panel, or before you move the platform. There are question cards. Everybody in the room, if you did get a question card, there are people in the back of the room prepared to bring them around. We would like you to write your questions down. If they don't get to all the questions today, we will have an opportunity to have someone reach out to you. So grab a bunch of question cards, or if you could walk the room and make sure that everybody raise your hand. If you need a couple of question cards, they will get those in your hand. Write your questions down as the panels go along, and we will have someone come and collect them so that we can get your questions to the panel as they're presenting. So raise your hand if you need question cards. Write down your questions, and we'll be prepared to take those.
Well, good morning. It is an honor and a pleasure to be here this morning. I am a life member and also a golden member of Alpha Kappa Alpha sorority. I'm also a retired nursing professor, hospice nurse, you name it, and I've done it. But again, it's a pleasure to be here, and I'm going to have my panel introduce themselves, and then we're going to go ahead with our panel discussion.
Thank you. Well, good morning, everyone, and it is a pleasure for me to be here. And thanks to Alpha Kappa Alpha sorority for putting this event on, because there's nothing more important in our society today than really focusing on health, because health is significant in every aspect of our lives. But my name is Vanessa Greene, and I am the CEO of the Grand Rapids African American Health Institute. And our mission is to eliminate health disparities by influencing policies and practices for African Americans through community engagement, advocacy, education, and research. And we've been serving this community for over 22 years.
Good morning. What a beautiful morning to stay woke. But so welcome. I'm Syreeta. I'm a psychiatric mental health nurse practitioner, also a nursing professor at Mount Community College And also, I am the second vice president of the Grand Rapids Black Nurses Association. So you see us out here in the community. So we are grateful and thankful to Alpha Kappa Alpha for inviting us to be a part of this very timely and important community conversation.
I don't know if this is on. My name is Aundrea Robinson-Burris. I am the president of the Grand Rapids chapter of the National Black Nurses Association, and our chapter was founded in 1998 by two of the young ladies that are here today, Miss Ernestine Talbert and Miss Laura Moody. Laura B. Moody, let me correct that, Miss Laura B. Moody. So anyway, but we are very happy to be here, and thank you for inviting us to talk about health disparities and how we can improve the health of our community, because that is what we focus on in our organization. How do we stay healthy and how do we prevent a lot of the chronic conditions that are existing in our community?
And good morning, everybody. Good morning. My name is Dr. Candace Smith-King. I am a pediatrician at Corewell Health, Helen DeVos Children's Hospital. I am an outpatient pediatrician, so I only see patients outside of the hospital. Inside is a whole other level of care that you do not want me to provide. In addition to being a pediatrician, though, I'm the Vice President of Academic Affairs, which means that I am responsible for all of the residents and fellows that we have walking through the halls of Butterworth and Blodgett Hospital, which are over 440 residents and fellows training to be physicians. One of my goals in impacting health disparities is to bring more Black and brown physicians to the Grand Rapids community, because I do recognize the role that seeing someone look like you, take care of you, impacts what you're comfortable saying.
Thank you. Okay, we're going to go ahead and get started. Again, if you come up with questions a little bit later, raise your hand. They will give you a card so we can help answer those questions. I'm going to go ahead and start off with our first question, talking about chronic conditions. What systemic barriers are contributing to the higher rates of chronic diseases like asthma, diabetes, and hypertension among Black residents in Grand Rapids? And what evidence-based solutions are being implemented locally to address them? I'm going to address this first with Vanessa, then I'll have the other panel come in.
Okay, so GRAAHI was literally founded in 2003 because of disparities in health in the African American community. And it was based upon a community health needs assessment survey that was done by the Kent County Health Department. And so based on that assessment, it revealed more daunting than anyone could have imagined, the level of disparities in all aspects of health, whether it's asthma, diabetes, heart disease, stroke. African Americans fared worse than any other racial ethnic group. And Dr. Greene was the president of the Urban League at that time, and Dr. Conrad was the chair of the board. And they looked at that needs assessment and decided that the Grand Rapids community really needed to address it. And from that, they formed various different committees around the city, had focus groups, listening sessions with African Americans, and learned more. So there's one thing to have quantitative data, but then to have the qualitative lived experiences of the voices of the community sharing their stories and their experiences. And so, and that's how GRAAHI was founded. But what they found from those listening sessions was chronic diseases are rooted more than within the medical system. It really starts with social determinants. So the systemic racist issues that we face every day that heightens our stress levels, increase our behavior. And so we're dealing with chronic diseases, we're dealing with racial issues, we're dealing with oppression, all of those kinds of things. And then we're living in environments that don't provide us with access to equitable housing, equitable food, healthy options, all those kinds of things. Green spaces, physical spaces for kids to play in, all of those things impact our health. And so chronic diseases is only 10% or 20% is related to actual medical issues. The other 80% are related to basically social determinants of health, where we live, and all of the different inequities that we face.
Thank you. Also, Syreeta, could you add to that, please?
Yeah, so just to add a bit to what was already stated, yeah, that issue is, so Black and brown people are not more genetically predisposed to have these disparities. It really is a matter of racism. And so when we talk about, it was asthma, hypertension, and what's the other diabetes? Yeah, so, and those are systems set in place, strategically designed, so that these communities are not able to thrive. So as we continue to get more providers of color, have more people of color participate in some of the studies, so that the research and everything can be a bit more balanced. So there was a question about what evidence-based practices and things are being done to help combat it. That can be a bit skewed because we're often not a part of the evidence collection. Right, so having organizations like the ones represented here today, going out in the community, so like with GRAAHI and GRBNA, and having doctors of color, that will help because we have an inside track to our people and a connection to our people, and also the passion to serve. So it starts there with highly skilled and qualified individuals, the collaborative endeavors, going out and doing the community outreach and the screening, and also walking alongside our people and to help, because there's a healing part and a restorative part and restorative justice part that needs to be done in conjunction with access and quality in these different spaces.
Aundrea, did you want to add?
So when we look at our families and we look at what we learned as young people, we have to take an inventory about what type of habits we developed because of what we were taught. And if we are not taught in our schools or in our families how to live healthy lives, then we won't. If you are not taught to eat the right foods, then you won't. If you are not taught to exercise on a regular basis, or if you are afraid, which is one of the systemic barriers, is the neighborhoods that you live in that keep you from exercising because you don't want to go outside and play, because you don't live in a safe neighborhood, that's a systemic barrier. But we need to understand that it's going to start with our youth, with our children, and teaching them those healthy habits early. If we do not do that, we're going to lose. We're going to keep having these problems and nobody is going to get better, because we need to be working together to teach people how to live healthier lives, and that's where it starts.
Dr. Candace, I'm going to start off with the next question for you on maternal and infant mortality. Why are Black mothers and infants in Kent County at significantly higher risk for mortality, and how can hospitals, midwives, and community health programs work closer together for this?
That's a heavy question, but Black infants are 3 times more likely to die than a white infant. And if you just let that sink in, that means that there's a whole lot going on with this issue. So if we look at just the racism like we discussed before, Black women and the level of stress that I think our bodies carry on a daily basis impact our bodies in a way that makes that fetus, that baby that we're carrying, with stress, and then the baby's in a stressful environment. So I think the level of stress that Black women carry plays a role in it. That can be due to the micro assaults. That can be due to just the everyday stresses of being a woman, a Black woman in society today. The second thing is access to care. Black women tend to seek care later. And it's not that we seek care later, I shouldn't say it that way. There are some resources that don't even provide care until a certain point in the pregnancy, right? So say you have a primary care doc and you have the best insurance in the world, you can go tell your primary care doc, I want to see you, my pregnancy test was positive yesterday. What if you don't have insurance? What if you don't have a primary care doc? Where are you going to go to start your prenatal care? Where are you going to go? Right, you have to figure that, you got to find somewhere that's going to take you. You got to figure out how you're going to get insurance. There are a lot more barriers in place for you to get the care that you need, so you tend to seek the care late. Late care is not good care. When you are caring for a baby, that baby takes 40 weeks to gestate. That means you have 40 weeks to get your body right, and you want to get your body right at the end of that, right? So then it goes back into the environmental factors, the neighborhoods we live in, the foods we're putting into our bodies prior to even getting pregnant. You can't get pregnant drinking a 2-liter every day and thinking your baby or the eggs in your body are living in a healthy environment. They're not. We have to drink water, so it goes back to the health and the need, what we're doing to our bodies prior to being pregnant, when we're young people, when we're kids, the being active, walking around, those are the things that will help us have a healthy pregnancy. And then not to speak lightly on just the way Black women tend to be treated in the hospital and how sometimes their symptoms are not recognized the way that they need to be by some of the professionals that are in the hospital environment. And so as a Black woman, you do have to advocate for yourself on a very different level when you walk through any hospital. And I think teaching Black women how to advocate for themselves is one of the things that I wanted to empower us to do after this conversation today.
Aundrea?
Screening. So we are not screening young people or people who are of childbearing age for chronic conditions. Cardiovascular disease is one of the major causes of death among Black women who have had a baby within the first year after they have their baby. We are not screening these young women. I'm not sure if you know, I just did a learning module that's sponsored by the American Heart Association that identified that 80% of women who have depression before they get pregnant are more likely to develop cardiovascular disease during their pregnancy and after their pregnancy. So we need to be screening these women. We need to be taking the time to screen them for depression, screen them for cardiovascular disease, and making sure that they have all of the resources to stay healthy. Because if you're not screened, you never know that you have it. We went to a church and did some blood pressure screenings, and it was a young man. Only had like a few, I had like 5 people that came in. But one of the young men, he was in his 30s, and his blood pressure was highly elevated, and he had never been to a doctor. He hadn't gotten it checked. He didn't know he had high blood pressure. Gave him a blood pressure cuff. He checked his blood pressure for a week, and I followed up, and he had to get put on medication. But if he had never been screened, he would have never known that he was at risk for having a stroke. So we need to be getting screened. We need to screen these women who are of childbearing age early and get them the treatment that they need to prevent these adverse outcomes.
So, all the stuff that we heard, so I second all of that. And then when we talk about screening, not all screening tools are created equal. Sometimes when we always go when we go to the doctor, there's something called the patient health questionnaire in particular, and it talks about, have you felt like, have you been down or have you been worried and all of these different things. And so the screening tool is usually only as good or as useful as the person who is informed is taking it. And so what I mean by that is if you tend to carry stress, maybe you won't answer that a certain way because you're like, I don't know where they're coming at me. With these questions, I don't know what it's designed to do, or I don't want them in my business. What are they getting ready to do with all of this? So I think, we hit heavy on the education component of it because you have to understand what is actually being done with this data that we're collecting. And when we talk about, incorporating midwives and the infant and maternal health, we are in a crisis. We have the most availability. We live in what would be considered a medical mecca, especially here in the Grand Rapids area, and our numbers are horrible. And what I want to say about those numbers, they're numbers, but those numbers represent lives. And when it comes to Black people, that means lives lost. And so it is not an adversarial type of approach that we need to take. It needs to be both medical model and nursing model and community model. And where all those things intersect, that will set us up for a very, very, because it's a work, right? So it's going to take all of us. So nurses don't have the breadth
and depth of training that physicians do by design, that's medical model. Then the nursing model, we have a lot more built into our programming and the way that we do our nursing care to be out in the community and spend more time with the people, right? So if we can come together and work from that aspect, because you don't really have doctors making house calls, right? You might have nurses and community organizations that are out in the community, and so these are all touch points. And to echo a little bit more with what was said here, as far as like the depression, I don't think we should ever have a conversation about any health condition without also addressing the mental component, because it's going to start in your mind first, where how you process information and you understand the information. So many times, and I'll just end this, pass this on, because I get a little bit passionate about this, right? Because when we talk about generationally, there's intergenerational trauma that we carry in our body, right? And so you don't know that when you get headaches and things, sometimes it could be due to high blood pressure. There's all these things that we really don't understand. So that's why being out in the community and doing these screenings are important, because it opens up the ability to have a conversation. And sometimes we're educating, and then I hear a person say, I was supposed to take this pill twice a day, but I would forget. So when I wake up in the morning, I just take 2. Now, as an educator, I understand most people miss things in the area of what I call application. It said twice a day, I don't want to forget, so I'm going to take it twice when I remember. But then they get dizzy or they get lightheaded. So some of the side effects of medication, right? Could be due to how people take the medication and they just don't really understand it. So even having that safe space where we can have a conversation and starting there, because it's really going to start with the knowledge and then with all of us, because we all have unique perspective and value to add to the conversation. In the end, it's going to transform lives and impact the future.
So you're following on the bench as well. So infant maternal health is one of the driving force of the establishment of GRAAHI because of the disparities. Black mothers are dying like 3 times at a higher rate than white mothers, and Black infants were dying at the same rate compared to white infants. And so this is really serious when it comes to the birthing of our community. And I'll just share a recent experience that I just had because I've been bragging about being a grandma for the first time. So I have a 7-week-old grandson, but I'm also doula trained, and historically in the African American community, birthing was typically done by midwives. And health systems understood the economic enterprise of birthing, and so they have now kind of like transformed and transitioned the mindset that, oh, we have to go through like the hospital system and so forth. And so that's when a lot of the disparities in maternal health started happening, is that when we got out of the midwifery birthing system to like the hospital birthing system. And not to like, disparage health systems, because there's a lot of good in that, but I think that it's very important as Black women and Black community to understand the importance of advocacy, and that's why the involvement of doulas is really taking a lot of form, and people are trying to address some of the health disparities through the doula program. And doulas really work side by side, birthing moms, and provide them with a lot of information of the education process, and they're kind of like the bridge between the birthing mom and the hospital system. And so just going back to an experience that I just recently had with my daughter, and why self-advocacy is so important, and having a birthing plan is incredibly important. But one of the areas that Black women face all the time that we found in research and listening sessions and so forth is the concern about not being listened to when they talk to their doctor about their experiences and so forth. And so the experience I had, my daughter, she decided to get an epidural. And when you have a birthing plan, you follow the mother's choice. And so she had a reaction to the epidural, and then the baby wasn't dilating, and so if she moved a certain way, then the heartbeat dropped, and this happened like several times through the process. And I got really concerned, she was concerned, we both were communicating to the birthing team that we had concerns about, how the baby was doing, and if she continued with the natural process, how this may endanger her and the baby. We were not listened to. So I had to get a little bit belligerent about it, and long into the process, after being belligerent and expressing our concerns, a Black physician came in and decided immediately that they needed to rush her to have a C-section. And so these are the kinds of things, like real life lived experiences that Black mothers and families experience, because I'm there, a trained doula, professional in public health. She's actually a physician herself, and still was not heard. And so it took a Black physician. And this is why culturally competent care is so important. And we are also, we lead a program to increase diverse leaders in healthcare. And I can tell you, when you think about systemic injustices, we're in this community as an African American Health Institute working with all these health systems, and not one of them are really like leading into this opportunity that's like right in their hands to really work with us on this initiative to increase diverse leaders in healthcare. And so, but all the research, it shows how important it is to increase diversity in healthcare, but people are not taking advantage of the opportunities that are right in front of their face. And so, and then they often make us think that we're crazy, when we have all these disparities in the community. Oh, it's because we're not eating right, it's not because we're not dieting. No, it is the systemic systems that are in place that are perpetually creating these disparities and these obstacles for us to get the help that we need and deserve.
Thank you. As you see, we have a wealth of information, so we're going to keep it moving here. Okay, our next question is in regards to mental health access. How is racism, trauma, and economic stress contributing to the poor mental health outcomes? And reported by Black residents, what culturally responsive mental health supporters are available as far as what is needed in our area? We're going to start with you, Syreeta, and from Syreeta, Dr. Candace, and then Aundrea, and then Vanessa.
Ooh, well, ooh, that's a lot. So, I'll say this, we don't have enough, okay? We don't have enough out in the community. And we've lived our whole lives with our brains, and not many of us, right, have cared for it the way we might have cared for our physical bodies. And it's partly due to the fact that, it's what society or maybe media might tend to focus on. And a lot of times that will be directly correlative to money, right, and reimbursement. So I mention that only to say that when you carry depression, and most people that I talk to out in the community, they are so what we call resilient. Everybody familiar with the word resilient? I start to think about resilience as a trauma response, because what is the alternative? If you have to keep going and working and paying your bills and taking care of your family, I don't know that you have the luxury, so to speak, to sit over in a corner and just console yourself and rock for 3 or 4 days, right? So it is about normalizing. When we talk about mental health, it really is mental wellness, okay? It is about understanding that everything that happens to you has to be processed through the mind. Your emotions, are they regulated? Are they not regulated? And because of that, when we talk about the Black residents in particular, we have another piece that we have to mention as well, and that is the piece of spirituality, and how those two things really should complement one another. But then you have some people that might be of the frame of mind that there's something going on with me, I'm just gonna pray about it. Now, I love Big G, and my relationship is very strong with Big G. I will say this though, he has given us knowledge, right? And so it don't have to, you say, well, if I pray about it, I don't have to take my medication, or I don't have to seek help, or I don't have to, and I think so the normalizing. So what I've seen out in the community is there's a lot of pastors pastors, and churches. And so when we talk about community partnership, let's remember the churches as well, because they have been increasing not only the awareness of mental health and everything, because you'll have a demographic of people that will go to the churches and might not be going to their doctors regularly. So when you start having those messages normalized that, hey, your brain needs its own specialized care, right? Because how can you even comprehend if you don't really understand that something might be off? And as we get older, you have to understand that losing your memory is not a normal part of aging. So people will think that dementia is a normal part of aging. So all these different things that affect the mind, or stress. So if you're stressed and you're carrying it in your body and you start having hypertension, we could learn some breathing techniques. There's cognitive behavioral therapy. There's so many different modalities that can help you process and deal with all the mental health components that you can just tap into. You don't necessarily have to go to a doctor's office or whatever, but you can connect. And so it's about getting the information out there and just having a normalized conversation that you can pray, take your medication if you are prescribed medication, or just do some self-care and some self-help and have the conversations. And the thing last thing I will say before I pass it on is that culturally, a lot of times we carry, since we've been so resilient, we don't always just want to talk the problem all the time, but there can be a sickness associated with keeping secrets, right? And just keeping things in all the time. And so really having dialogue, purposeful dialogue, and being intentional about that dialogue, there's something that is very healthy about it, because you need some type of outlet. So if you just hold all that stuff in, it is going to manifest physically in your body unless you get it out of you. So what you think about, you talk about. What you talk about, you bring about. Let's be healthy.
I'm only going to add one thing, because she really did hit everything that I need to say. But before you go to see your physician, go see your therapist. Because I think the disconnect between what is happening with your physical health and your mental health is only because of the way this society has set it up.
Yes.
What I would love is for all my patients to go see the therapist before they come into the room to see me, so that I can really just deal with what drug I need to prescribe and not have to do it. Go get it out, go talk it out with somebody, because that's what you need to do. If every symptom on the review, we do a review of symptoms before your visit, y'all probably wonder why we do that. So you'll look on the chart and you're like, do you have headaches? Does your stomach hurt? Have you had a cough? Some people answer all of them, yes. That's when I'm like, you can go see your therapist. You can't have all these problems and have just walked in here on time. You have something else going on. So I really challenge everybody, before you go see your primary care doc, before you take your child to see their pediatrician, especially if it's an adolescent.
Yes, yes.
Okay, if they're over 12, please get them a therapist.
Yes.
And go see your therapist first. Deal with your mental health. And then what can't be fixed by that provider, what you can't talk through with your therapist and fix. If your anxiety is impacting your ability to go to work, then you come see me.
Okay, let's go ahead. Healthcare, access and trust. How can healthcare systems in Grand Rapids rebuild trust with the Black community, particularly when past experiences of discrimination and neglect have led to deep skepticism? Dr. Candace.
Is that me? That's a hard one. I think we want to have more physicians of color that look like our patients, right? But obviously that's not going to happen overnight. So we need to have culturally competent everybody, right? Every time you walk into any healthcare environment, you need to have people that understand your lived experience and can relate to you in some way. They may not have to look like you, but they have to be able to relate to you. The other thing I need to plug is just the children that are coming through, because I'm a pediatrician. I need to see more kids who actually want to go into healthcare. What I can't do is grow doctors. It does not happen. The way we push our kids or push kids to do sports, we need to push them to do math and science and go into some of these. People can holler on the basketball court and they can bring home an AP biology grade, and we act like the AP biology is an amazing class that's going to get people into healthcare. Just thank you, Ned. I appreciate that. We really need to encourage our kids. So STEM greenhouse, All of the resources that our kids have to get really embedded in math and science, push that, because I cannot grow doctors.
Thank you. Okay, community engagement. How can local healthcare organizations partner with effectively Black-led grassroots groups of faith communities to create health equity and solutions? Aundrea, and then Syreeta.
It's really important that these hospitals and these clinics develop relationships with the organizations out here who have the connections with the community. Because in order for us to educate the community, the doctors don't have time to educate in their doctor's appointments. They got maybe 15 minutes, 20 minutes to see you, 10 minutes to see you in their appointment. They don't have 30 minutes to go over education. So what does that mean? That means we take on and we bear that responsibility to educate our people, to educate the community, and give them the resources that they need in order to be healthy. You can't do any better if you don't know any better. If you keep doing the same old things, you're gonna keep having the same outcomes. So in order to do new things, you have to have changed behaviors. And the changed behaviors come from practice and from learning it. Just like when you go to exercise and you go to the gym, your body learns those different movements, and you create muscle memory, just like you do with your brain and everything else. So you need to be able to learn those things, but you can't do that unless we develop those relationships so people learn how to be healthy. And when they go into the doctor, they can say, oh yeah, I've done this or I've done that and I tried that and it's still not working. What do I need to do? Because everybody wants a pill. Everybody wants Ozempic. Nobody wants to exercise. They want to get the pill or they want to have the surgery. And that's not healthy, and that's not going to keep you thin, right? Because you still have to maintain that and maintain those behaviors once you get that. A lot of these doctors make you go through a psychological evaluation before you can even get the surgery, because they need to know whether or not you're going to even be able to maintain it. So you have to get your mind right, as we said before, but you also have to learn healthier behaviors. And I think that comes from collaboration with these grassroots organizations.
Sorry.
I think you have to repeat the last part of the question.
It says, as far as partner with Black-led grassroots groups, faith communities to create healthy equity solutions.
Yeah, it's about having a voice at the table, right? We cannot collaborate. I call them like the suit and tie people. So if the suit and tie people they're not reflective of the community, where they want to impact or change some of these type of disparities, then where are they getting their information from? Right? Like you could read something, you could watch a documentary, but if you have people, if you want to impact Grand Rapids, invite the Grand Rapidians to the table so that they can have a conversation about what is directly impacting them. And I would also say that when I am in the hospital helping and doing some advocacy, we'll show up. If you get discharged, you don't understand your discharge instructions, all that kind of stuff, because that's like our language, right? So what I've seen is that a lot of people, they're happy if their pastor comes and visits them, but it can't just all be the pastor, right? So it's really gonna take all of us showing up, all of us being educated. And if there's things that you don't understand, then reach out. But it all starts with intention, having a voice at the table, a seat at the table, and then doing something with what you hear. Not just inviting people to check a box, but actually doing something with what is suggested and what is said. Because once you do that, then we can continue on and then change lives and change this community.
Okay, I'm going to go ahead, since we're on like a time thing, I'm going to go to the next question here. Youth and preventive health. What strategies are being used to educate and support Black youth in managing preventive chronic conditions early in life, and how the schools and after-school programs contribute to this. Dr. Candace?
I think we hit on some of this already, but the one thing I would like to share is when you are allowing your 12 or 13-year-old to go to the doctor, let them answer the questions for themselves and start to take ownership of their bodies. The first few years, I would honestly say 12, 13, 14, you can sit in the room while they're talking to the doctor, but by 15, you need to leave. Let me talk to them. Let me ask them some questions that they may not want you to know. And it also means that you have to trust the doctor that you're taking your child to. But allow that child to learn their body and to take advantage of being in the room with the physician. And I think that's the gap that I see, because then I'll have a 20-year-old who really has never been in a room without their parent. And I'm seeing them for the first time, and they're like, I'm like, do you have headaches? I don't know. When was your last period? Their mom is not in the room to tell them when their period was. Their child needs to own their body.
Okay, this is just a couple questions we have from the audience. One of them is, what are practical strategies for women to advocate for health for themselves? Vanessa?
So one of the things that we've been talking about a lot is systemic racism and systemic injustices, but advocacy is so important. And before I get into the advocacy, one thing that I wanted to really emphasize is that as we're talking about systemic issues, I also want to emphasize our personal responsibilities for our health. And based upon chronic diseases, whether it's diabetes, stroke, kidney disease, all of that, one of the things that we've learned through research is that the maintenance and prevention of that are very similar in terms of diet, exercise, and behavior management. So those three things we want to emphasize to the community, that those are things that you can do for yourself to improve your health and to maintain healthy lifestyles. So exercise is important, you guys. Nutrition is very important in self-care, because we know as a community we will take care of everybody, committees, church, work, boards, everything, and then when it comes to ourselves, we're too tired. So we have to really engage more in self-care. In terms of advocacy, no one knows our bodies more than us. And so being able to advocate, and I really love telling this story about my husband. Several years ago, he had a disease called sarcoidosis, and he had gone to the doctor, and basically they just told him that, oh, it's a flu virus and so forth, and wanted to just like push him off. And he said, no, I know my body, and I've had flus and colds and so on and so forth. This is different. And so he went, and the doctor then sent him to get a lot of testing, and through those testings, then it was discovered that he had sarcoidosis. And so his sarcoidosis had been in remission for like over 20-something years. We know a lot of folks, women, men, it's very common in the Black community, who have sarcoidosis. But one of the things is that distrust kills us. And so when we have these symptoms, we often delay going into the hospitals. We delay, seeing our primary care physician until it exasperates to a place where then is more out of control. And so I encourage everyone to know your body and to advocate. And another thing I was thinking about when I was invited to be on a panel is we pay $800 a month for our medical insurance through our companies, right? That's a lot of money. And so if we have symptoms and we're not using the medical insurance that we have to go and get the examinations, we're just throwing our money like in the trash can, essentially. So most of us, even when we're getting medical coverage through our companies, we're paying into that coverage. And then we're not taking advantage of the access to care that we have. And there are a lot of folks in our community who are underinsured. And so, there are different, resources for folks who are underinsured. We have Cherry Health, we have Catherine Health, we have Exalted Health. So there are all kinds of different health options for folks in the community to be aware of, but advocate and utilize the resources that you have, particularly with the insurance benefits that you're paying for through your companies.
Okay, thank you. Last question here. It's sort of twofold, Dr. Candace, I'm gonna give this to you. Is serving a new doctor, how do we know if they are culturally competent, and what are the questions we should ask them? And also, what is the pathway going forward in regards to disparities in the healthcare?
I'll tackle the first one.
Okay.
That was a little easier. So you have the opportunity to go see your doctor for that very first visit. Some doctors will allow you to do a meet and greet. Call the office and say, can I do a meet and greet with this particular physician? Use the internet to your advantage. Google the physician. Where did they train? Where did they go to medical school? Everything is on the internet these days, right? Find their Facebook, their Snapchat, their TikTok, see what they follow. Those are some other options. Another thing on the Corewell website, and I'm sure this is also on other websites, is you can see if a physician is LGBTQIA friendly. That shows that they are also probably more prone to working with diverse populations, and they're open to people who are not exactly like them. So use some of the resources that you have. But in that first conversation when you meet the doctor, feel free to say, so have you ever treated a black person? How do you feel about black people? Just you, that's your time. You are paying for that time. So just ask me exactly what you want to know. And if I look at you like I've never seen a black person, then you probably should say this is not the position for me.
That's right.
What was the second question?
What is the pathway going forward for disparities in healthcare?
That's a big one. I think, as we discussed already, there's multiple pieces to that puzzle. We're not going to solve health disparities just by saying we need more black physicians. We need more people of color in politics. We need the environment to be healthier, right? We need the air quality in certain neighborhoods not to be as bad as it is. But we also need to understand why those neighborhoods look the way they do, right? We have to understand the politics behind all of that. And how do we tie all of our community resources in to help with our patients? Are our healthcare facilities in the right places? Are our grocery stores in the right places? Where can I get fresh? Health disparities is so much more to think about than just the four walls of the hospital. It's honestly the cities and the communities we live in.
Thank you. I'd like to say at this time again, we thank you for the opportunity to be able to your own. As nurses, we are out here, we're in the community, we're advocacy, we go to the doctors, and it's really interesting when we go to the doctors, they don't know I'm a nurse, and I'll listen to what they're saying, and when I ask the question, they'll say, oh, are you in the health field? So there's a lot of that's going on, but you need to have someone with you, know your body. Because if you don't know your body, like our panel was saying, no one else will. If you got something going on, you have to stand up for it. Give us a call. We're there for you. Whatever we can do, because the body you save may be your own. Thank you.